I mean, one of the main things that we're looking at in terms of oral health are kind of three things, really, when you're doing a lot of these sports. One is the potential for getting tooth decay. Next one is the potential to getting tooth erosion. And then the final one is gum disease. And actually, I would add another one into that, and that is your oral health affecting your general health, and therefore your ability to perform in a race or in just kind of keeping fit and keeping on top of it. And I want to sit here and be the man on the street, kind of staying fit, whereas you are on the high end athletic side of things, you two. So I think it's what I want to do is try and kind of make sure that the message is not just for the high end athlete, but also how do we make sure that people are thinking about those points of health in their normal fitness things. So does it actually go through your, I mean, Angus, you're kind of like a very much an interesting kind of situation, because you're doing this really intense kind of fitness training, but you're also a dentist. And so that must be going through your mind a bit when you're in those kind of stages as well.
But then when you think about it, though, I've got a very good diet, 99% of the time. I'm only really consuming carbs for anything longer than an hour and a half, 2 hours. And a lot of my high intensity training is an hour to an hour and a half. So you don't need to supplement that with additional. And this is the thing about parkrun, is you don't need to take a gel beforehand or an energy drink. Although there is some science that by having a sugary solution in your mouth, you can get a neural feedback that actually releases more energy. But for the average Joe, you don't actually need to do that. I would say, though, it's the kind of years of good health, and probably I've got a better saliva bacterial composition in that I've probably got less strep mutans compared to someone who has dental caries who says, I never eat sweets. It's like, how have I got fillings? So this is where it's a bit feast or famine when it comes to the carbohydrates. There's very little refined carbohydrate, and then suddenly there's a lot. But it is a bit of a perfect storm of dehydration, mouth breathing, grazing, and is the saliva ever able to get to be able to neutralize the acids enough that we're avoiding damage?
This is it. I mean, I suppose, when we think about tooth decay, that's a balance of a number of things happening at one time. It's the bacteria that's in your mouth that is kind of metabolizing, eating the sugar that you're putting in, and then it's sitting on your teeth, particularly when you haven't got the saliva there to wash it away and neutralize it, and that then causes cavities. And you see, they did some brilliant studies looking at Olympic athletes, and they found that they're way more prone to tooth decay and gum disease. And that's because they're obviously really kind of like working it hard at their fitness, and they're having to consume a lot of carbohydrates to do that over many, many years. And that takes a toll on the teeth, because it's continuously, you're feeding those bacteria, and those bacteria are producing acid, which is then eating away the teeth themselves.
Do you, Angus, when you're on the bike, do you had been advised to have your carbs and your water, so pure water. Do you ever, I mean, I don't know how, are you having support on the ride? I assume you are. You're not going alone.
Basically, when you look at, it's a spider's web of a route because of the Flanders region. So it's going all over the place, so that we are going to designate stops where we can stop at a cafe. But again, when we're at a cafe, what we're going to eat? Cake.
I was just, exactly. No, I was just thinking about wasting your water. Obviously, it's precious. You don't want to waste your water. But I often, I can't stand gels, so I have to have the little jelly cubes. So I try those instead. But when you're dehydrated, Mike, you can imagine it's hot, running along, you're dehydrated, your mouth's got nothing in it. So you're then eating a cube of jelly, basically, which has got everything you need in. Sometimes it's got caffeine in, sometimes it hasn't. And then this sort of sticks in your teeth. So I often find that I'm having some water and generally just trying to get as much of the sugar off and down me rather than sticking on my teeth. They
Yeah,
taste vile as well, but I just wonder whether you try and get rid of it, so it's not sticking on your teeth, especially for 9 hours. Your first OT bar in the morning is still going to be there in the evening.
I think I have less issues with like the actual sort of food, like the oat bars. They don't feel so much as tenacious, but the energy drink does. It feels like you've got a film, like you can actually feel the like a biofilm forming in your mouth.
Yeah.
It's not
Yeah.
like, when people say their mouth feels furry, you definitely feel that. And it's compounded by the fact, because of mouth breathing as well, it's really going to dry your mouth out. So I think just over time, I've just learned to alternate, and because we're not racing, it's not like we can't stop and then have something instead. But I'm just mindful of it. And one of the things, when I did a race in Italy a couple of years ago, I had my picture with a little pack of Dr. Hefts, because that was 6.5 hours of continuous high intensity stuff, and I was in a bad way, and I knew that something like that is actually very important to start that remineralization process. And I guess potentially on using it on a daily basis, this could be where it's altered my oral biome, and that might have been altered anyway because of what I do with Zoe, that's made me have less pathogenic bacteria. So that's possibly where I've been a bit more favored compared to some people.
Yeah, and the other bit that I wanted to kind of just talk about there was, Angus, is did you have the ingredients in what you normally fill up your bottle with? Because so what are the ingredients that are in there? Is it possible to tell us what's on the pack?
You can buy it commercially, and Science and Sport, they made a very kind of not groundbreaking, but they commercially produced something called beta fuel. So the beta fuel was combining two energy sources. So you've got glucose in maltodextrin form, but also you've got fructose. So when it's in your gut, you've got different transport channels. So this is where it's elevated the amount of glucose or the amount of sugar you can consume, because it used to be you're limited to 40-60 grams an hour, and now it's 80, and some people are up to 120 grams. But yeah, I make my own because it can get incredibly expensive. So I just buy a big bag of maltodextrin and a big bag of fructose, and I measure it out in my bottles before I go out. But yeah, that's how much sugar effectively would be in one bottle. It's a hell of a lot. That's 80 grams. Yeah.
That's insane, isn't it?
It's insane. When you think of what's in a,
so that's 20 spoons of sugar.
Yeah. It's a lot.
And you're having that constantly tick, tick, tick over the time. So,
well, alternating with the water. Yeah.
And is there any, I mean, in some of these other gels and things like that, are there kind of other acids and things like that in them? Or is it like for flavoring? Like sometimes you look at some of the sports drinks and they have kind of various like malic acid, citric acid in it and things like that as well.
Yeah, and that a lot for those preservative side of things. So that there's not anything that's healthy from an oral health point of view. It's all purely designed for poor performance and negating everything else. Yeah.
Because the concern with some of those acids is that they will grab the calcium that's in your saliva, that's naturally in your saliva, that actually helps to remineralize your teeth, and it grabs hold of those acids, and it also lowers the pH in your mouth as well. So what that effectively does is it actually softens your teeth. And I guess if you're gritting your teeth or whatever throughout, I don't know if you do throughout your cycle, then you're just wearing down your teeth in a far greater way than you would if you didn't have the acid on there in the first place.
Yeah. No, you're quite right. Because I knew a nutritionist who works with some of the world tour teams, and I talked to them about, the concerns we have about oral health. And they say from a professional point of view, all they're thinking about is the next 20 minutes. They don't care if they have a negative effect. And and I don't want to make a sweeping generalization here, but when you think of the very, very high level athletes and some of the background to cycling in the past and the use of performance enhancing drugs without necessarily thinking of what the long-term consequence might be. Okay, when we think of oral health, it might not be as severe, but it's still the case of a lot of people may think, I don't care about that. I just want to perform at my best. And if it makes me 0.1 second faster than my competitor and I win, then it's worthwhile. And then I'll deal with the consequences later.
I think that probably brings up more to the fact that having a good, stable, preventative oral package from the start, the best we can do, we're not really going to be able to help your teeth on that 9 hours a day during that trip. We can do our best, but what we can do is, as you said, you've got a pretty good preventative history, how you've looked after your teeth up to now. Your diet when you're not in those extreme situations is pretty good, and also you're using products like Hefts that are hopefully and looking at it through your Zoe, hopefully changing your microbiome, so that when you are putting it under that kind of that strain, you've got those kind of I don't know whether you look at it as like a protective vest already on those teeth, so that they're going to go under the hammer a little bit, but it is only for a certain number. And as you say, during training, it's a couple of hours at max. Maybe, would you say? You're not going out for 8 hours at the weekend, are you, or anything silly? Probably you are.
Actually, the long ride is kind of 4 to 5 hours.
Okay.
Just from an endurance point of view.
Yeah.
But that is generally it's low intensity, because you're actually looking to boost your fat burning with the same idea. It's faster than doing the keto. You're building mitochondria, so you can be more efficient for longer, burning more fat and preserving glycogen. But one thing I did to throw a spanner in the works, I emailed Mike and I said the skeleton in the closet is the new supplement, which is ketones. Have you heard of exogenous ketones?
No.
So ketones is an alternative pathway, and it's come into cycling in the last 4 or 5 years, and people are being incredibly secretive about it. There's not anything inherently dangerous about ketones, but they don't know if they're going to ban it because of the potential cognitive enhancement, but also performance enhancement, because the body will preferentially metabolize the ketones to therefore preserve your very small supply of glycogen, so the sprinter can ride 200 kilometers and still
smash it out at the end.
Sprint. But it's the big leading group is in the Oxford University. They're delta G ketones, and they're kind of the best known and probably the best researched. But they're actually marketing it not just for sports performance, but actually in business in terms of cognitive enhancement, and they're used with special forces. And I used it when I went to Mallorca. I just wanted to try it out. The first thing is it tastes absolutely disgusting.
I was going to say, what form is it? What form is it in?
It's just a liquid form, and it tastes, and not that I've ever tasted nail polish remover, but it is like that horrendous taste. And the thing that I found was I wasn't as fit as I wanted to be, but when we did a long ride in hour 5 and hour 6, I was actually feeling fresher than I should have done, because I've been taking the ketones, and where we'd been at equivalent level, I was kind of pulling ahead. Again, it's an N+1. Is there necessarily a placebo effect? But there's also an element, it can enhance the recovery. So on day 5, I was actually feeling a lot better than I should have been, where I've previously done multi-day things and the fatigue catches up with you. You can see it in your heart rate is suppressed, your effort levels and pain, muscle pain, and just general feeling of malaise. So that is, again, the constituents of the ketone again, that hasn't been researched from an oral health point of view, but it is a very small amount that you're taking probably once every 2 hours. So the timing in your mouth is going to be very small. But it'll be interesting to see what comes out of that in the future from a research point of view.
Yeah, I'm going to go straight onto Google and have a look now.
Yeah, they're very expensive, by the way. Like the Delta G one, a little bottle which is 2 shots is probably about 30 or 40 pounds.
Wow.
Oh, dear.
Wow.
What's
But
that
again,
refined from then?
That in terms of that chemistry, that is something that is quite complex. And I have watched podcasts and things and thinking, whoa, this is real next level stuff. Hence why, you know, Oxford University have developed this over a long time, then produced this commercial product. There's a lot of protection around it in terms of the constituents and how they actually came about to synthesize it. And obviously there's intellectual property still attached to that.
Seems remarkable that it's not banned almost before it's got running. You know, you think like you're obviously heavily into cycling, but if you think about, you know, ultras, you know, 50k plus, 100k, 100 milers, the fact that you could just keep going and keep going and keep going and then still be able to catch your nearest rival towards the end of the race, amazing, really amazing idea.
But like when you look at all this research, they'll show what an average response is. You'll have super responders, and then you'll have people who have zero response. Like another thing in cycling is concentrated beetroot juice, because the high nitrate levels. And again, this is an interesting thing. It's once it's absorbed and released in the saliva, it's then the oral bacteria that are converting it into nitric oxide. And that is a huge variation between people. And I do take, on some occasions, I've taken beetroot juice, and is the effect a placebo, or have I seen a true effect? And that's what's very difficult with supplementation, is actually being able to identify that it's made a huge difference. And I just had that kind of slight feeling about the ketones. It's not like the effect of things like blood doping or EPO, which is massive, which is just like off the chart. This is like a few percent, like 5 or 10%, not the 30-40% people we get with doping with EPO and the other drugs. So
did that nitrite one is quite interesting, because again, if you are using the wrong type of oral hygiene products, you might be damaging those bacteria, which can actually
we were talking about that previous
microbiome. Oh, were you? Sorry.
Just the fact that how widespread the use of mouthwash is, you know, and I step back because of obviously being in sort of in the know, as it were, when you have a patient sitting opposite me saying what they're doing, and you think you've got to have that mask on of what are you doing? And they're quite clued up about their general health, their diet's good, and you know, other sort of stuff, and they genuinely feel by using those sort of products that they're actually doing themselves a lot of good. Obviously sales marketing has a lot to do with it, but
I find it incredible when you think about that. That's your saliva is then impacting on your blood pressure, your heartbeat, your circulating oxygen. What an incredible connection of our mouths to the rest of our bodies, which we're still trying to reinforce day to day in dentistry, how your dental health impacts on your general health.
And the look of surprise when you suggest it as well, and disbelief in some patients as well.
But it was interesting what I said about the whole Zoe thing. I think it's been fascinating. I had a really bad sinus infection about 10 years ago, and for whatever reason, I was prescribed antibiotics for 4 weeks, which decimated my gut biome, of which I didn't know that at the time. But then I suddenly developed nutritional deficiencies. I was like vitamin B12 deficient, vitamin D deficient, and I was in a really bad way. And that's when things like I was reading about the gut biome, and obviously Michael Mosley, which we very sadly lost recently. And then I was thinking, gosh, that's when I changed massively my diet. And then when I moved over to Zoe, when I looked at my blood sugar response to certain foods, I changed how I eat, and that's had a huge effect on my general mood. But the thing that a lot of them, with no disrespect to some of medicine, but they're forgetting the portal. It's like what's happening in the portal influences everything else.
Yeah.
In terms of what's happening in the mouth. And we've known that in periodontal research, you know, the influence of inflammation, how it can affect so many other aspects of the body. Yeah.
Exactly. And again, I mean, that's what's happening in sports personnel all the way around the world, because you are getting inflammation because of that buildup of plaque, and then that impacts general health as well. So again, kind of coming back to the basic messages of this is to make sure that your dental health is good, make sure you're looking after your mouth prior to a sports event and after a sports event as well, because that has an impact on your performance.